Welcome to Blessed to Rescue CPR. Today we will be going over adult-only CPR. What is CPR? CPR is performed in the order of CAB, compressions, airway, and breathing. Begin by pumping the oxygenated blood from the heart throughout the rest of the body. The airway must be open and clear in order to deliver adequate breathing. Breaths are delivered to fill the lungs and re-oxygenate the blood. The steps to performing high-quality CPR: identify the emergency, check for scene safety, check for responsiveness, check for pulse and breathing, call for help, begin CPR. Identifying the emergency. Look for signs of distress. The sooner you act, the better chance a victim has for survival. Check for scene safety. The scene must be safe in order to rescue a victim. Remember, you cannot help anyone if you are also in danger. Check for responsiveness. Shake the victim and loudly ask if they're okay. If they do not respond, chances are they need help. Check for pulse and breathing. When saving a life, every second counts. Take at least 5 seconds, but no longer than 10 seconds to check for breathing and pulse simultaneously. To check the pulse on children and adults, use the carotid artery. To find the carotid artery, find the center of the neck and slide your 2 fingers into the groove. When checking for a pulse, never use your thumb because your thumb has its own pulse in it. Always check on the side closest to you, pushing down until you feel a pulse. While checking for the pulse, watch for chest rise and fall at the same time, keeping in mind that 10-second rule. Find the center of the neck, slip your fingers into the groove. No longer than 10 seconds. Watch it for chest rise and fall at the same time. If there is no pulse and no breathing, call for help. Compressions and hand placement. Find the breastbone in the center of the chest. This is the large flat bone that sits right above the heart. Using your dominant hand, place the heel of your hand in the center of the chest, using the other hand for support. Your shoulders should be directly over your hands, locking your elbows to use your body weight for compressions. To compress the heart, push down 2 inches or 1/3 the depth of the chest. Allow the chest to fully recoil or rise before delivering the next compression. Push at a rate of 100 to 120 beats per minute. Deliver compressions at a ratio of 30 compressions to 2 breaths, or 30 to 2. The compression to breath ratio is the same for 1 and 2 rescuers in adult. Remember to push hard. Your goal is to push the blood from the heart throughout the rest of the body. A victim is more likely to survive if you push too hard rather than not pushing hard enough. One cycle of CPR is 30 compressions to 2 breaths. CPR must be performed for 2 minutes or 5 cycles before stopping to check for pulse. Remember to minimize all interruptions to less than 10 seconds during the duration of CPR. If there is a second rescuer, in order to prevent fatigue, switch roles every 5 cycles or 2 minutes. Check for pulse every 2 minutes. You find the 2 nipples. Place your hand in the center. Check for that bottom breastbone. This is what you're using to push, this bottom part. If you have a weak hand, you lead with a strong. You can either lock your hands or leave it open. Center of the chest. Rescue breathing. Deliver 2 breaths after each set of 30 compressions. Deliver each breath over 1 second. Deliver just enough oxygen to see the chest rise. Watch for chest rise and fall before delivering the next breath. If the victim has a pulse but no breathing or no normal breathing, deliver rescue breaths only. Deliver breaths every 6 seconds for adults. To deliver breaths, use the head tilt chin lift maneuver. Remember, the airway must be open and clear in order to deliver adequate breaths. Mouth-to-mouth breathing. Tilt chin and lift head in order to open the airway. Close off the nose so no air escapes the nose while delivering breaths. Place your mouth to the victim's mouth and blow just enough to see the chest rise. If a breath is delivered and you do not see a chest rise, repeat the head tilt chin lift maneuver and deliver another breath. Keep in mind the 10 seconds. First, you do the chin lift head tilt maneuver. You pinch the nose closed and cover the mannequin's mouth. Pocket mask. Use the shape of the mask and the bridge of the nose to guide you with mask placement. The skinnier end of the mask should go over the nose. Rest the bottom of the mask against the chin. Be sure not to let the mask hang over the chin. This may cause for air to escape. Use the E-C clamp technique in order to seal the mask. Make a C with your thumb and index finger, allowing the rest of the fingers to represent the E. Your C will seal the mask to the victim's face, while your E will lift the head up, opening the airway. This is the valve for the pocket mask. Mask is still going to go over the nose and the mouth. Make sure that there's no room. Tilt the head back. The E-C clamp. You're going to use the E-C clamp, C, and your E is going to tilt your head up. Seal, E-C. Watch for chest rise. A lot of times I see my students, when they give breaths, they want to blow as hard as they can. The reason you don't do that is because you're going to cause either gastro inflation, or you're going to damage the lung, overinflate the lung, and you can cause a rupture. So you just want to blow enough air to see the chest rise and fall. Bag mask device. The bag mask device, or bag valve mask, is used in 2 rescuer CPR. Use the same technique used for the pocket mask. Use one hand to create the seal, and the other hand will squeeze the bag to deliver breath. The compressions to breath ratio does not change. While using the BVM, it may be easier to use your body to help squeeze the bag. The AED. The first and most important thing to do when using the AED is to turn it on. Follow the prompts given to you by the AED. Use the pictures on the pads for pad placement. An AED cannot be used in water. If a victim is wet, quickly dry them before applying the pad. The AED may be difficult to use on a hairy chest. In this case, quickly shave the chest or use one set of pads to rip the hair off, using another set of pads to apply to deliver the shot. If a victim has a medicine patch, quickly remove it and wipe the space before applying the pads. Never apply pads directly over a medical device. This will look like a small elevated area in the top right chest. If you listen to your AED, there will be beeps to guide you with compression. Okay, so this picture is here, and this picture goes here. I'll show you again. Remember, turn it on.
Apply pads to patient's bare chest. Plug in pads connector next to.
This is how you connect these. You connect each pad. So, follow your picture. Upper right chest. Lower left side.
Apply pads to patient's bare chest. Analyzing heart rate.
Adult choking. Choking is commonly recognized by the traditional signal of grabbing the neck or gesturing towards the neck. When a victim is choking, we use the Heimlich maneuver to maneuver the object from the throat. Stand directly behind the victim. Wrap your arms around the victim's body. Find the navel. Place fist above the navel into the abdomen with your thumb side in. Cover your fist with the palm of the other hand. Deliver inward upward thrust into the abdomen. Deliver thrust until object is removed or the victim becomes unconscious. If unconscious, begin CPR as normal, with the exception of checking for the object before delivering each breath until the object is removed. For pregnant or overweight victims, place hands over the chest instead of the abdomen and deliver thrust. High quality CPR. identify the emergency. Check for scene safety. Check for responsiveness. Hey, 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 are you okay? Are you okay? On that side I am. Finding the sick. Find the groove. Shake like that. Call 911. Bone help. Find a nipple line. If you or someone you know are interested in taking a CPR course, Bless to Rescue CPR offers BLS as well as Heart Saver and First Aid courses. We also offer blended or e-learning courses, which allows you to take the online portion on your own time in your own home. Just be sure to contact Bless to Rescue CPR to perform your skills test with an instructor.